Oxycodone is a potent opioid analgesic used for pain management. Its pharmacology involves several key aspects. 1. Mechanism of action. Oxycodone primarily works by binding to opioid receptors in the central nervous system CNS, specifically the mu-opioid receptors. This binding results in the modulation of pain perception and the central reward pathways. 2. Pain relief. Oxycodone provides effective pain relief by reducing the transmission of pain signals along the nervous system, altering the perception of pain in the brain. 3. Metabolism. Oxycodone is metabolized primarily in the liver by enzymes, primarily CYP3A4, to form its active metabolite, neuroxycodone, and other inactive metabolites. The metabolism can vary among individuals due to genetic and environmental factors. 4. Pharmacokinetics. It has a relatively rapid onset of action, typically within 15 to 30 minutes when taken orally. Its effects can last for around 4 to 6 hours. Oxycodone is available in various formulations, including immediate release and extended release forms, allowing for different durations of action. The dosage of oxycodone can vary depending on the individual's medical condition, pain severity, tolerance, and the specific formulation of the medication. It's essential to follow your healthcare provider's instructions carefully when taking oxycodone. Here are some general dosage guidelines. 1. Immediate release IR oxycodone for adults with moderate to severe pain. The typical starting dose is 5 to 15 milligrams every 4 to 6 hours as needed. The maximum daily dose is usually around 60 to 80 milligrams, but this can vary based on individual circumstances. 2. Extended release oxycodone. Extended release formulations are designed to provide long-lasting pain relief. Common brand names include Oxycontin and Xtampza. The initial dose for opioid-naive patients is usually lower, such as 10 to 20 milligrams every 12 hours. Oxycodone, like other opioids, can have several side effects, and their frequency and severity may vary among individuals. The most common side effects of oxycodone use include 1. Constipation. This is one of the most common side effects of opioid medications like oxycodone. It can often be managed with dietary changes, increased fluid intake, and over-the-counter laxatives if needed. 2. Nausea and vomiting. Many people experience nausea when taking oxycodone, which can sometimes lead to vomiting. Taking the medication with food or as directed by your healthcare provider may help reduce these symptoms. 3. Drowsiness and dizziness. Oxycodone can cause significant drowsiness and dizziness, which may impair your ability to drive or operate machinery safely. It's essential not to engage in activities that require alertness until you know how the medication affects you. 4. Itching. Some individuals may experience itching or skin irritation as a side effect of oxycodone. 5. Sweating. Excessive sweating or sweating that is out of the ordinary can occur with oxycodone use. 6. Dry mouth. You may experience a dry or parched feeling in your mouth while taking oxycodone. 7. Respiratory depression. While less common, high doses or misuse of oxycodone can lead to respiratory depression, which is characterized by slowed or shallow breathing. This is a severe side effect that requires immediate medical attention. 8. Mood changes. Some people may experience mood swings, anxiety, or even depression when taking oxycodone. It can also lead to euphoria, which can contribute to its potential for misuse and addiction. 9. Tolerance and dependence. Over time, individuals may develop tolerance to oxycodone, requiring higher doses for the same pain relief. This can also lead to physical dependence, and withdrawal symptoms may occur when trying to stop or reduce the medication. 10. Gastrointestinal issues in addition to constipation. Oxycodone use can lead to other gastrointestinal issues, such as abdominal pain or cramping. 11. Urinary retention. Some individuals may experience difficulty urinating while taking oxycodone. Oxycodone, like many medications, can interact with other drugs, potentially affecting its effectiveness or causing adverse effects. Some of the most common drug interactions with oxycodone include 1. Central nervous system depressants. Combining oxycodone with other central nervous system CNS depressants, such as other opioids, benzodiazepines e.g., diazepam, alprazolam, sedative hypnotics e.g., zolpidem, or alcohol, can increase the risk of respiratory depression, sedation, and even overdose. These combinations should be avoided or closely monitored under medical supervision. 2. Monoamine oxidase inhibitors. MAO is our class of antidepressants. Taking oxycodone with MAOs can lead to dangerous interactions, potentially causing serotonin syndrome, a severe condition characterized by symptoms like agitation, confusion, rapid heart rate, and high blood pressure. 3. Serotonergic medications. Combining oxycodone with other medications that increase serotonin levels, such as selective serotonin reuptake inhibitors SSRIs, or serotonin norepinephrine reuptake inhibitors SNRIs, can also increase the risk of serotonin syndrome. 4. Anticholinergic drugs. Some medications with anticholinergic effects, like certain antipsychotics, antihistamines, or tricyclic antidepressants, may increase the risk of constipation when taken with oxycodone. 5. CYP3A4 inhibitors and inducers. Drugs that affect the activity of the CYP3A4 enzyme in the liver can alter the metabolism of oxycodone. Inhibitors, such as some antifungal medications and certain antibiotics, can increase oxycodone levels in the blood, potentially leading to overdose. Inducers, like certain anti-seizure medications, can reduce oxycodone's effectiveness. 6. Medications for gastrointestinal issues. Some medications used to treat gastrointestinal problems, such as antidiarrheals or antispasmodics, can interact with oxycodone or exacerbate constipation. 7. Medications affecting liver function. Drugs that affect liver function may alter the metabolism of oxycodone. Individuals with liver issues may require dosage adjustments or alternative pain management options. 8. Naloxone. Naloxone is an opioid receptor antagonist used to reverse opioid overdose. Some formulations of oxycodone e.g. Trigenic include naloxone to deter misuse. Combining such formulations with other opioids may lead to reduced pain relief. 9. Herbal supplements and over-the-counter drugs. Some herbal supplements and over-the-counter medications, like St. John's wort and certain cough suppressants, can interact with oxycodone. It's important to discuss any supplements or OTC drugs with your healthcare provider.